Good morning, Dan and Amy. And interesting Twitter thread from the Great Barrington Declaration crowd. And it is a crowd, by the way. I know this doesn't get much coverage or attention in the D.C. press corps, from the D.C. press corps. But, this is the collaborative work of some of the leading epidemiologists in the world from some of the leading institutions in the world. Martin Kulldorff from Harvard, Sunetra Gupta from Oxford, and Jay Bhattacharya from Stanford. And some 50,000 medical professionals, actual medical doctors, public health professionals have signed the declaration, as have some, more than 500,000 just ordinary people like you or me, in support of opposing thoughtless lockdown policies. So as this sort of second wave of lockdowns, in some respects, even more arbitrary and draconian than the first wave back in the spring, as they're being imposed around the country, particularly in big cities and big blue states. Great Barrington Declaration responded on Twitter, "We are resolute in our criticism of the lockdown response to COVID. There's a growing body of evidence-based studies that show the collateral damage being caused by the current approach is causing devastating harm that will be felt for years. Since March of 2020, cancer screening has been suspended, routine diagnostic work deferred, and only urgent symptomatic cases prioritized for diagnostic intervention." And they cite in that one part of the thread to a study published in the Lancet detailing the increases in the number of avoidable cancer deaths in England. The pandemic has resulted in an inflation in acute cardiovascular disease, and there's a study supporting that. I won't get into the details here for time's sake, but our elders are suffering terribly from isolation, depression, and deteriorating mental health. The children growing up in this year have faced so many challenges and suffered untold harm and overwhelming isolation. People battling drug and alcohol addictions have relapsed as support groups close their doors. Men, women, and children living with violent partners and partners have been trapped due to the lockdown. Vaccination programs have been halted, the result of which will be catastrophic for so many. Tuberculosis will surge, and polio cases are rising. Poverty and famine, already a global issue, is now going to affect more of the vulnerable. And again, there's sort of supporting stories in all of this. And by the way, this against the backdrop of the UN World Food Program being conferred the Nobel Peace Prize, for the work they're trying to do to maintain supply lines for food and supplies in the developing world from the first world, despite these lockdown policies, which, again, the UN Special Envoy for COVID opposes.
Here in Chicago, University of Chicago says, we have hospitalizations up in part because people put off going to see their doctors and oncologists and the screenings that are needed. And that's why they have a surge in beds.
They put them off, or they were forced to put them off?
They were forced to put them off.
Right.
They wouldn't let, the doctors' offices were closed.
For more on this, we're pleased to be joined by Daniel Klein, professor of economics and the Ginn Chair at the Mercatus Center at George Mason University, associate fellow at the Ratio Institute in Stockholm, and chief editor of Econ Journal Watch. Daniel Klein, thanks for joining us. Appreciate it.
My pleasure. Thanks for having me.
Well, first, before we get to all things related to COVID and lockdown policy, when will George Mason University be renaming itself Colin Kaepernick University or something a little bit more temperate? I note in Falls Church, Virginia, George Mason and Thomas Jefferson have both been removed per the school board as appropriate individuals to honor with their name on the school.
I hope never, and it would be a real shame, and I'm sure people would speak out against it, so we'll see.
Yeah, I hope so too, but these are the times. It's just worth noting what's happening at the K through 12 level too. It's not just the universities, as we try to remind people. So talking about lockdown policies, and the Great Barrington Declaration is holding fast based on what they've always stated as those signatories as contained in their declaration. But Sweden, and since you're over at the Ratio Institute in Stockholm, has relented a bit. Anders Tegnell seemed to be sidelined a bit, and the politicians are moving more in the direction of some of the lockdown policies of their Scandinavian and Western European neighbors. Why?
I think the government, not Tegnell is my understanding, but the government itself is succumbing some to just all the international pressures, as well as maybe some public sentiment that just has the do something mentality. I think it's a real shame. I do think that the backpedaling on kind of leaving things open is overstated. That is to say, a lot of the leftist press is overstating the extent to which lockdown is now being reinstated in Sweden. I was in Stockholm City yesterday in the grocery stores and so on, and very few people are wearing masks. A lot of the rules are still only advisory or recommended. So as I say, I think that the backpedaling is less than reported.
And the beauty of Sweden is you never had hard lockdowns and you always kept your schools open. Now, I know some high schools and universities were closed for a few weeks in March, but don't you feel free over there? And aren't you proud of the government over there compared to what we're going through?
Absolutely, without question. I'm sorry to see the backpedaling to the extent that it does exist, but still, yes, it feels much freer over here.
And don't you think lockdowns are more about politicians grasping for power than about science?
Something like that. It's definitely not science. It's definitely not concern for the well-being of society, at least not a sound concern. I think people are in sort of a denial and a delusion. I think it's a kind of madness. It's politics. You guys were reviewing all of the ill consequences that come from not just, that there's a disease out there, which is real, but the lockdown itself and the frenzy and panic that's been propounded by hysterical media and others. And those other factors, the frenzy and the lockdown, I think are the main causes of all those ill consequences. And when people, advocate lockdowns, they just seem to ignore all that collateral damage, as you called it.
There may have been a bit of a watershed moment, just thinking about this in economic terms, at least from an analytical point of view, with this LA County judge that issued an injunction against the prohibition on outdoor dining in LA County. And in his opinion, he just said, basically, you have no evidentiary basis for this. No risk-benefit analysis was done. I mean, what a concept that risk-benefit analysis would be done before a policy was pursued.
Yeah, it's amazing what's going on without any evidence. I mean, there's no real evidence that lockdowns even reduce COVID deaths. It's not at all clear that it's significant. Meanwhile, it's creating all these other ill consequences. They go on, the ill consequences. They're economic, they're personal, they're moral and cultural. We're getting used to trampling of civil liberties, breakdown of the rule of law, being tyrannized by our government. You got to wonder what kind of nefarious impulses are behind this.
Well, and just on the sort of the moving of the goalposts or the recasting of expectations once we achieve a certain milestone. So one of the milestones is, of course, the vaccine being finally approved by the FDA at some point in the hopefully not too distant future.
Oh, is it?
No, it was advised. The working group advised the approval. That's not the same thing. We still don't have the approval, so you still can't release it. But when that does happen, now what's the story now? Something that has been said previously, including by Fauci, but it wasn't paid much attention to because it's just all hands on deck, vaccine, and then we'll be America pre-COVID-19 again. Hold the phone.
No,
vaccine may not prevent spread. So now when the vaccine is distributed, they'll say, well, it's great, it's starting to be distributed, but it doesn't necessarily mean it'll prevent the spread. We don't know how long the antibodies last, so on and so forth. So we're going to have to continue with these policies that we've had in place for the last, going on 10 months.
Yeah, you guys called me originally because I wrote this piece for AIER, Darth Sidious's Lockdown. Darth Sidious, for those who don't know, is the evil Sith Lord in Star Wars. And, what we see in terms of consequences of an action, what we see depends a great deal on what we think is intended. And if all of this was being done by Darth Sidious, for whatever reason, because he's an evil Sith Lord, then we would look for evil consequences, and we would be seeing all those ill consequences, and we would be screaming about them. But because there's this narrative of Dr. Fauci, well and good intentions, there's more attention to the supposed good consequences of reducing COVID infections and deaths, and the other gets thrown into darkness. So I think we got to start just thinking, like, what are the real intentions behind this, or at least figure that they're not good. Like, we might just throw up our hands and say, I don't know what those people are thinking and why they're doing what they're doing. But we have to look at all the consequences, and then we see how catastrophic and calamitous this policy has been.
You referenced in your piece the Darth Sidious analogy, and if people don't know who Darth Sidious is, then shame on you. You better go watch the Star Wars movies. But you mentioned Nobel laureate Ronald Coase too, and his dissertation on the problem of social cost and how that's applicable here.
Yeah, well, he said when you're considering a policy measure like lockdown, and let's say you're comparing that to no lockdown, to, leaving things as they were before all of this, you have to consider all of the consequences, the total effect, as he put it. And the total effect and ill consequences goes on and on. It's really tragic and catastrophic what's happening. And people are just not responsibly facing up to the total effect of lockdown.
He is Daniel Klein. He is professor of economics and Ginn Chair at the Mercatus Center, George Mason University, associate fellow at the Ratio Institute in Stockholm, and chief editor of Econ Journal Watch. Professor Klein, thanks for joining us.
My pleasure. Thanks for having me.
And he joined us on our turnkey.pro answer line.
This is the morning show more Chicago radio listeners are choosing. This is Chicago's Morning Answer on AM 560. The Answer.
The Lou Dobbs Financial Report is brought to you by Signature Bank, helping local businesses succeed. Visit signaturebank.bank for your commercial banking needs.
I'm Lou Dobbs. U.S. budget deficit up 25% in the first 2 months of the budget year. A German court halts felling of trees at the site of the Tesla plant. Those stories and more next. You've all probably heard of asbestos and know that it's dangerous. And you may also know exposure to asbestos is the only known cause of mesothelioma, a deadly cancer. People who were exposed to asbestos decades ago are being diagnosed to this day with mesothelioma. That's because it can take as many as 30 or even 50 years